All right, now we're moving on to part 6 of the JFK Autopsy report. I'm Dr. Wolfe. I'm a forensic pathologist with expertise in gunshot wounds, and I have reviewed this at the request of many people. So we're going through it page by page. I'm now on page 5, and this is from archives.gov if you want to look it up and follow along. The next part is kind of a little bit boring. It's basically just pathologist speak for all of the observations that he made on the internal examination. Incisions. The scalp wounds are extended in the coronal plane to examine the cranial content, and the customary Y-shaped incision is used to examine body cavities. So these are standard incisions. The coronal plane means if you were to cut this way across the head, that is the coronal plane. So the incision goes up and over the head, and then they reflect the skin forward and backward in order to get access to the skull. And then the Y-shaped incision is the classic autopsy incision. Thoracic cavity. The bony cage, or rib cage, is unremarkable. The thoracic organs are in their normal positions and relationships, and there is no increase in free pleural fluid. And that's more evidence that the bullet did not pass into the pleural cavity, or else there would be blood. The above described area of contusion in the apical portion of the right pleural cavity is noted. We discussed that in the last video. Lungs. The lungs are of essentially similar appearance to the right, weighing 320 grams, the left 290 grams. So he's saying there's no big difference between them visually. And then they weighed about the same, but usually there is a difference in weight between the right and left lung. The right is typically heavier because there's 3 lobes. The lungs are well aerated with smooth, glistening pleural surfaces and gray-pink color. A 5 centimeter diameter area of purplish red discoloration and increased firmness to palpation is situated in the apical portion of the right upper lobe. And that's that ecchymosis or hematoma that was produced by that bullet shock wave that I showed you in the last video. This corresponds to the similar area described in the overlying parietal pleura. Incision in this region reveals recent hemorrhage into pulmonary parenchyma. The heart. The pericardial cavity is smooth-walled and contains approximately 10 cc's of straw-colored fluid. That's a normal finding. The heart is of essentially normal external color and weighs 350 grams. That's a normal weight. The pulmonary artery is open in situ and no abnormalities are noted. So the pulmonary artery is open in situ. This is kind of a little bit of his procedure that he does on every case, because that is something you would do in order to look for pulmonary embolism, which is completely irrelevant in this case. Let's continue on. The cardiac chambers contain moderate amounts of postmortem clotted blood. Postmortem clots is something we see in everyone. It doesn't matter really when they die or what they die of. There's always going to be postmortem clotting. There are no uh, gross abnormalities of the leaflets of any of the cardiac valves. The following are the circumferences of the cardiac valves: aortic 7.5 centimeters, pulmonic 7 centimeters, tricuspid 12 centimeters, and mitral 11 centimeters. So basically, we measure the valves in order to see if there's a symmetry or an asymmetry of the heart. The myocardium is firm and reddish brown. The left ventricular myocardium averages 1.2 centimeters in thickness. The right ventricular myocardium, 0.4 centimeter. The coronary arteries are dissected and are of normal distribution and smooth-walled and elastic throughout. So in other words, Kennedy had a really healthy heart. 46-year-old male. A lot of 46-year-old males do not have hearts that look that good. So his heart was basically perfect. Abdominal cavity. The abdominal organs are in their normal positions and relationships, and there is no increase in free peritoneal fluid. The vermiform appendix is surgically absent, and there are few adhesions joining the region of the cecum to the ventral abdominal wall at the above described old abdominal incisional scar. So if you remember what I talked about, he had that McBurney incision that they said, that was his appendix scar. And so when the appendix is taken out, there's a little bit of adhesions, usually a little bit of scarring around that area. Skeletal system. Aside from the above described skull wounds, there are no significant gross skeletal abnormalities. And then finally, he has a section here where he says photography. Black and white and color photographs depicting significant findings are exposed but not developed. These photographs were placed in the custody of Agent Roy H. Kellerman of the U.S. Secret Service, who executed a receipt therefor. Rentgenograms Rentgenograms are made of the entire body. Those are x-rays of the entire body and of the separately submitted 3 fragments of skull bone. These are developed and were placed in the custody of Agent Roy H. Kellerman of the U.S. Secret Service, who executed a receipt therefore. Now, that seems like a rather kind of boring description. And why do we do that? Because we do that because a complete autopsy is important in homicide cases. We need as much data as possible. I can assure you that the smallest little detail in these organ descriptions have been gone over by the forensic pathologists, by conspiracy theorists, by people trying to find anything that could explain how and why he died. And sometimes we do find uh, details in these organs that help us understand underlying medical conditions which may have affected the ability to live. In this case, mostly irrelevant. I didn't see anything in these descriptions that would have changed my opinion of this case. And we're going to do at least one more video on this autopsy report where at the very end of the report on page 6, he has his summary and he's basically giving what he thinks happened in this case. I'm going to go over that summary, which I may be able to do in one video, but then I'm going to give my opinion on whether or not I agree and anything that may have been a little iffy with this autopsy. But this is part 6, and we will come back later.